Diabetes and other medical conditions can have certainly varying degrees of seriousness. And diabetes in particular can be easily measured by a blood test that tells us how in control the sugars have been. It's called a hemoglobin A1C. And this blood test tells us over a period of time whether or not the blood sugars have been in pretty good control or pretty poor control. And it's a bit shooting from the hip to go through all the different levels right here. But I will say, in general, a hemoglobin A1C of 6 or maybe 7 is reasonably well in control. As we get upper 7s to 8s and then beyond, we get really concerned. And we always want to be engaging with the primary care physician or endocrinologist who is helping adjust medication levels, either pills or insulin, to keep the sugars as under control as possible. We certainly have had to postpone surgeries because we've ended up finding a hemoglobin A1C that shows us that the sugars were not under very good control. And it was the right thing to do. We've then gotten them under control. We've gotten more healthy values, and we've had a much more predictable outcome. High levels of sugar in the blood can cause real problems with wound healing and also perioperative surgical risk. So we do want to get things as reasonably in control as we possibly can. And this is one of those cases where a multidisciplinary effort is the rule, not the exception. So we're working with the primary care doc and or endocrinologist, anesthesiologist, and the patient to all come together and control things as well as we possibly can and make things as safe as we possibly can leading up to surgery for patients with diabetes.